Surgeons, doctors of Reddit. What's the dumbest thing patients have lied about? Story 1. Not a doctor, but in patient care nonetheless. Guy comes in between 17, 19 years old for pebble hits penis. Pretty odd. He says he was doing yard work when the tool knocked a pebble into his penis. He went to check it, and now it was making pus. Nurse clarified that he was wearing pants. Denies sexual history. He stands by that he got hit on his penis by a rock through his pants that made him produce pus. He had chlamydia. Guy says he was forced to do meth, or something similar, at a store. Came in because he thought he was dying. A fun bonus. A frequent flyer comes in for his stomach hurting from eating this chili he had, while continuing to eat said chili in the lobby. I have a few funny other stories that I'm just going to add for the fun of it. Woman comes in after doing crack and states now she feels sad. That's all we got. Older woman who OD'd on something says she thinks her son poisoned her, who she hasn't had contact with in years. Old man with various infections, but his pubic hair was green. We still do not know why. Guy came in for vomiting on Thanksgiving because he ate too much, but it was really tasty. No other complaints and felt fine now. Addict left AMA because he had to go to right now. He was in for other issues, but had to leave immediately to do more. He eventually came back for treatment, thankfully. Minor comes in for poisoning. Turns out she had food in the microwave, sprayed said food in microwave with roach poisoning, then ate said food and vomited. Now, comes into ER on Thursday. Events happened Sunday because she was having contractions. She was also 27 weeks pregnant and eating roach poisoning, that last one. I had a kid doing theater in a show I just directed who presented as super sick for one show. Sweaty, pale, can't stay out of the bathroom. Classic stomach bug, and there'd been one going around. He looks at me while we're waiting for his mother to arrive to take him home and says, ugh, this always happens when I eat chili. Wait, this has happened before. Yeah, like once a week when we have chili. Kid and his mom knew full well he got sick every time he ate chili, but never considered not eating chili. I can't even. Story 2. Woman comes to emerge with complaints of vaginal discharge and discomfort. Pelvic exam initially reveals significant yeast infection, but there appears to be a foreign body in her vagina. Is there something stuck inside? No, I don't know what's in there. Speculum examination reveals a very soft mandarin orange, peel still on. Oh, that! We heard it would improve our fertility. You can't make this shit. Story 3. Do you have any medical problems? No. So no diabetes? No diabetes. What medications are you taking? Metformin for my diabetes. I facepalm every time. Story 4. I had a guy insist that someone else put cocaine and in his urine, even after I tried to move on with the conversation. Had someone say that their roommate used a spoon when cooking, and then he ate cereal with that spoon later, and that's why his piss popped hot for amphetamines. Story 5. Guy came in for a wound on his lower leg that he said came from a biking accident. X-ray revealed a bullet inside his ankle joint. The wound was from shooting himself by accident while holding a gun. Still don't know how he didn't fracture anything. Story 6. Part of my job is dealing with medical records. My favorite part is when you're reading the doctor's notes and you can tell they are fed up with the patient's their tone. Patient in for routine colonoscopy. Asked if solids consumed in 24 HRS prior. Patient confirms no. In process of procedure, several dozen kernels of corn are discovered in colon and cannot continue. Patient specifically instructed not to consume corn beforehand as this happened prior visit. Story 7-1. Dude lied about being paralyzed after a lumbar puncture. Get a call from nurse patient says he can't move legs following a lumbar puncture. Spinal tap. I called the team that did the procedure and they assured me there was no indication of this sort of injury happening during the procedure, but agreed with my plan to get an urgent MRI. I go to examine him and nurse says she thinks he moved one of his feet. Next thing I know, he says he can actually move his legs again, but they are feeling weird. Then this weird feeling turns into intense pain and he asks for intravenous narcotics, Dilaudid. I tell him no, because this story makes no sense. By God, it was a miracle. I tell you when this man walked himself right out of the hospital after I refused the IV narcotics. By God, it was a miracle, I tell you, when this man walked himself right out of the hospital after I refused the IV narcotics. Also, the MRI was normal. I had a ruptured disc in my neck once and couldn't lay down because of the severe pain. I've never had to take medications for severe pain before. Nothing more powerful than Tylenol. I went in for an MRI and they gave me Dilaudid to be able to lay still for the exam. It made me understand just how easy it would be to get hooked on a drug. Such a euphoric feeling. Story 8. Patient. I haven't drank alcohol in months. Patient's family. It's true I've been with her the whole time. Me. Ma'am, your alcohol level is 325. Patient. Impossible. I would never lie to you. Story 9. Did cocaine the night before elective surgery. Didn't disclose at pre-op. Cardiac arrest, beta blockers, and cocaine don't mix well. Oh my God. There's a reason that do not give beta blockers for a overdose is in bold in med school textbooks. For those curious, you have alpha and beta receptors to help vasoconstrict and raise blood pressure. Blocking the beta receptors with a beta blocker lowers blood pressure in most people, except cocaine brain stimulates alpha and beta receptors at the same time. If you block just one, the other one keeps on going, and it can make blood pressure go dangerously high and cause a heart attack or stroke. Story 10-1. My favorite things I wrote my first year out of medical school. Please note patient has stated multiple times that he wants to leave and would leave AMA against medical advice. He asked multiple times whether he could eat and stating he is hungry. Explained to patient that we would like to start a full liquid diet first, and if he tolerated it well, would transition to regular foods. However, PT ordered Chinese food delivery instead. Then patient was complaining of a headache. Was given Tylenol for the headache. Patient stated that this did not help him. His sister at bedside went to the nearby pharmacy and bought goody powder. Aspirin. A sister did ask whether she could give him goody powder. She was told not to give patient the goody powder. She supposedly did not. For context, the patient had a catastrophic GI bleed from taking too much aspirin. Story 11. Do you smoke cigarettes? No, I quit. When did you quit? This morning. Quitting is easy. I've done it 1,000 times. Story 12. It's not so much a patient lie as it is me being dumb, inexperienced, and uncomfortable asking necessary questions. I had a hypothetical patient during residency that was a very manly veteran, and I was admitting him for rectal bleeding. He was in the age where it more than likely colon cancer, so I didn't think it was necessary to ask a sexual history. Folks at this particular establishment were known to at times be homophobic, and I had been yelled at by patients previously for asking, do you have sex with men, women, or both? It ate away at my conscience, though, so I went back in absurdly nervously and asked him. He answered, son, I'm as gay as a rainbow. I've been at the bathhouse for the last couple of nights, but I wasn't sure how it would go over to admit it. That's when the bleeding started. It was a very important lesson for me. Story 13. I had a lady tell me she had no idea how she got a rash she had on her face. I left the room, gave report to the MD, and when I walked back in with the doctor, she looked at me and said, I didn't think you'd be coming back in the room. And then proceeded to confess that she'd been cheating on her husband and thought she had herpes. She did not have herpes. If it makes you feel better, patients do this kind of stuff to EMS all the time, and the newer triage nurses must think they're all bad at their jobs. Story 14. My little brother was a nurse for about a decade. He has said many times that people stick anything up their butts, from light bulbs to hairbrush to a golf shoe. And at first it's hilarious. Then after a year or so, it's not funny because you've seen way too many distended buttholes. Then after a decade or so, it starts to get funny again, because you think you've seen everything, and then one day a 45-year-old man is driven to the hospital by his wife, and he has a golf shoe up his ass, and he told his wife that he and the boys were golfing, and he slipped in the locker room, and it got rammed up there, completely disregarding the fact that the part of the shoe that is inside him is covered in Vaseline. Story 15. Modification. The case was an elective above-the-waist surgery, and he denied piercings. However, when the nurse went to place the Foley, she found the patient had modified his penis, and it was split, bifurcated with multiple piercings to look like a cobra. The nurse did not know how to insert the Foley. The piercings also limited the ability to use electrocautery. In addition, he also embedded a metal implant inside his testicle that looked infected with a possible abscess. Cancelled case called urology consult for infection abscess evaluation. Story 16. A common one is about their smoking. Smoking is an enormous risk factor for fracture non-union, meaning a fracture that doesn't heal. When I walk into a non-union patient's exam room and it smells like a cigar den, I know they smoke, but they'll tell me they don't write to my face. Before signing them up for revision surgery, I'll commonly order a urine test for nicotine metabolites. Often it'll turn out positive and suddenly surprise Pikachu face. Lots of folks commonly believe that if you're a smoker, increases your insurance premium. This is true. However, the cost of complications after a surgical procedure would dwarf a lifetime of increased premium costs. I would still recommend that smokers be straight with their surgeons so they don't rush into surgeries that end poorly. And story 17, their identity. Insurance fraud using a friend/relative's insurance card. As a resident in a very large East Coast hospital, I was tasked to figure things out when the blood bank called and said their blood type changed. When confronted with getting the wrong blood that may kill them, they almost always tell the truth. This type of fraud has also resulted in people who have been dead and autopsied, raising from the dead and appearing in a clinic or ER. Story 18. I had a patient that lied about having a job I asked because he had hepatitis A, and I wanted to know if he needed a medical leave. He denied it even though I asked twice. Next day, he came back because he was going to get fired if he didn't provide a doctor's note. ETA. Some clarification. I'm in Venezuela. He wouldn't have had to pay anything for that visit, regardless of his employment status. He isn't an undocumented immigrant. It's a very small community where everyone knows each other, and he has lived there his whole life, and many of his relatives have also been my patients. Also, undocumented immigrants aren't really a thing here. Some tourists may come without having the proper paperwork, but this isn't really a desirable place for immigrants looking for work. He said that he didn't have a job. He didn't say that he didn't need a medical. I asked what he did for work in his second visit, but I can't remember what he told me. There really isn't a whole lot of stigma around Hep A around here, even if you work handling food. People just sort of feel sorry for the person person and tell them to not eat yellow things. So I don't think it was because he was afraid of being shamed, reprimanded because of it, but I could be wrong. I'm obligated to report viral hepatitis cases to the health ministry, so they make sure there isn't an outbreak. And I told him this, so he knew that it was going to be reporter either way. Story 19. Patient says to me, I was outside gardening while naked and I slipped. That's how a massive potato ended up in my ass. Anybody want fries while he's waiting to get it removed? How did you get that stab wound in your abdomen? I put a knife on the kitchen counter and forgot it was there. Then I walked into it. Me, have you had anything to eat or drink today prior to your surgery? Patient, no. With a half-eaten candy bar in front of them? Me, are you sure? Because if you have, you could vomit upon going to sleep and it could enter your lungs, causing you to die. Patient, then yes, I have. I had half that candy bar. This one guy repeatedly used to come in saying he hadn't in 7 days. This would usually necessitate a rectal examination with a finger. That's why he kept saying it. Patient used to come in every time the new doctors rotated in. Who wouldn't be wise to his tricks? One guy came in, feigning unconsciousness. Did not respond to even the most painful of stimuli. Some of these were pretty painful. Did not budge. We were talking amongst ourselves about intubating him. He then opened his eyes and said, they did that last time. I didn't like it. Story 20. Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they are taking medications when they clearly aren't, which is the vast majority. There's not much, really. Only one really unique comes to mind. It was a patient that was a really kind old man who always would talk a lot with us, telling stories, praising the beauty of everyone in a tender and respectable way, saying how really grateful for our work he was, and so on. Said old man would always appear with really high blood pressure values, even though he would swear that he always used his medication correctly. And after we did so many changes with his medication in many different ways, it's only natural to think that there's some problem with how he's tacking them, if he was doing it at all. However, one day, after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later, we also obviously discovered that he indeed would not take his medications correctly as well, in order to obtain this result again and again. Turns out he suffered a lot from loneliness, and he was an old man that didn't have much contact with his family anymore, but mostly because his family didn't reach out to him almost at any given time, even though everyone lived close by. And in his desperation, sustaining dangerous high blood pressure was the best way that he had to obtain human contact within the emergency every week. This was the most odd one, but it's really common in general among elderly patients to appear lying about their symptoms, only trying to gather some attention and a private minute to speak about anything else. Most of the time, they book an appointment only to talk about recent trivialities, which makes them clearly better. Although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness bring to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem, and one that no one should be bound to live with. Story 21. Medical school student. Not a big deal, but a patient lied to me about what she had eaten. She was obviously having some problem with her gallbladder. Typically, this pain can be caused by greasy food, so I asked the patient what she had eaten before she got this pain. Patient said she only ate a salad with very little ranch. That's it. I even explained how greasy food can cause this pain, but she's adamant she only ate a salad. Anyways, I report back to my attending and we see her together. The attending asked her what she ate. The patient said salad, then adds she also ate a burger. It wouldn't have changed the plan, but why lie? Story 22. Dad is a physician and has a million funny stories. He told me this one from a few decades ago. Had a patient come into the ER with a towel over his groin, covered in blood. Claimed he was cutting vegetables in his kitchen and the knife slipped. Dad takes a look and the guy is butchered down there. Had to call a urologist in the middle of the night to consult. Guy eventually confesses to trying to give himself a circumcision because he didn't want to pay the $200 it would have cost. Urologist was able to help save him, but it cost a hell of a lot more than $200 for emergency surgery. Story 23. Not me, but an anesthetist buddy screening a patient before getting anesthesia. We see that your drug screen came positive for cocaine. I don't know how. I don't do drugs. We can't to go forward with anesthesia. We won't know how the anesthetic will react with the coke. Oh, I know. My boyfriend does coke. I kissed him before I came in this morning. That must be how I tested positive. Story 24. Honestly, the dumbest lies are the one people who lie about how much alcohol or other drugs they use. Alcohol and benzodiazepine withdrawal can kill you. And if you use opioids from the street, then you likely have a higher tolerance and may need more medications in the hospital. So be honest, I truly don't care how much you drink/use. I just don't want you to get worse for something we can plan for and prevent. My MIL was taking 40 mg of oxymorphone every 8 hours and 5 mg of fentanyl twice daily prescribed. She weighed right around 100 lbs. She had surgery and was screaming in pain as soon as the anesthesia wore off. Nurse was absolutely perplexed as they gave her a full shot of Demerol. I told her to check her maintenance doses of daily meds. She went, oh and grabbed the anesthesiologist because she legally couldn't medicate her further. Her entire time in the hospital after having a good chunk of her liver, lung, and esophagus removed was hell for her between the surgical pain and the withdrawals.